Larissa Clint Scales, the Chief Operating Officer at Foothills Community Healthcare. We serve all ages 0 to 100, students, those who are working, retired, housed, not housed. We serve everyone. If Medicaid is expanded, it will help clinics like ours. It will also help the community. A healthier community is a healthier South Carolina.
My name is Jeff Howell. I'm an independent health insurance agent, and my office is in Lexington, South Carolina. I see the Medicaid gap on a daily basis. It's very discouraging when someone comes to my office and they're looking for my help as an insurance agent, and unfortunately I have no help to give them because they're working, they want health insurance, they want to pay for it. However, they don't qualify for any subsidy to make their health insurance affordable, and yet they've been denied Medicaid, so they fall into a gap. And the people in this gap are stuck between a rock and a hard place.
My name is Simeon Mutri. I am the pastor of The Brook in Columbia, South Carolina. The Brook was started in 2011. We've grown from 18 to over 2,500 in attendance. And our mission and our focus has always been on community outreach and trying to make a difference in our community. It's important that we look at expanding Medicaid because every week I serve families who work extremely hard. And it's not that they don't want health care, they just simply can't afford it.
My name is Melanie Bachman, and I'm from North Charleston, South Carolina. I feel like cancer is a pandemic that nobody is talking about, and so many people have cancer or have a loved one who's experienced cancer. So if I didn't have access to healthcare coverage for diagnosis services, I wouldn't be here today. I would have waited longer. And unknowing that I had the most aggressively spreading breast cancer at 35, I had no idea. But the longer I waited, my chance of survival was going down.
Those who do not have health insurance will delay or not even get preventive screenings. For example, cancer. They could be at a stage 1, but because they delayed treatment, now they're at a stage 4, which could be more deadly. When South Carolina expands Medicaid, 345,000 South Carolinians will have access to health care. That's a game changer. It will create roughly 20,000 jobs. I have heard this term being used, the working poor, and I think it does a disservice to those who are like freelancers, who are in the hospitality industry, your gas station attendants, a lot of small companies who don't offer insurance. These are South Carolinians who work, who contribute to society, who pay their taxes, all those things, and they just don't have health insurance.
Being a health insurance agent here in the state of South Carolina, in my opinion, this is not a Republican issue, this is not a Democrat issue. This is just us trying to help people in South Carolina gain access to health care who need it. This problem of the Medicaid gap in South Carolina will only continue to grow. I turn away people weekly in my small office here in the Midlands, but this is a problem that's happening every day across the state.
Having access to health care in the state of South Carolina is extremely important. Since most of the state is rural, most people are having challenges getting to health care facilities, hospitals, clinics, urgent cares because of the distance. The challenge of providing Medicaid to others is really the story of the Good Samaritan. It is someone who is wealthy, someone who is fortunate, someone who has resources, but yet sees someone else who's been taken advantage of and needs health care. And so he then takes this man who's on the side of the road and then provides health care for someone who couldn't afford it. That's what this is all about. It's important that as the faith community that we do what we can, but we also need legislators to look past the comfort of their own homes, to look at those who are less fortunate, to understand that it's not that they don't want it, it's just simply they can't afford it.
I've always lived a life that I'm passionate about. This wasn't a problem being very healthy in my 30s. And then I found a mass on a self-breast exam. About a year went by and the mass started changing shapes drastically. And I knew it was time to get it examined. And so I called the office and explained, and they suggested I contact the Best Chance Network, the state-funded program here in South Carolina that funds underinsured or uninsured women get diagnostic services for breast and cervical cancer. And so within a matter of days, I was not only approved, but given a list of clinics in my area that I could start the process of getting this mass examined. And within a couple weeks, I was diagnosed with triple-negative breast cancer at the age of 35. So I then began the long process of going through treatments, 5 months of extremely aggressive chemotherapy, 5 chest surgeries, and I just recently celebrated my 3rd cancerversary. I'm one of the fortunate people who have not only survived treatment, but also was able to get such a great response through chemotherapy and surgery. Currently, I do not have detectable tumor of known location. And because of this, I am now no longer eligible for the breast and cervical cancer program with Medicaid. I'm so grateful for the program and all it's given me. I wouldn't be here today if it weren't for the coverage. I really wouldn't. But there's also part of me that's angry because I survived this treatment and now I'm no longer covered. I did the things. I took the chemotherapy, I did the surgery, I survived. And now I'm uninsured again because my cancer is undetectable.
We can expand Medicaid in South Carolina by getting stories out. We need to hear from those who would benefit. We also need to hear from those like me in the healthcare field of how we want South Carolinians to be healthy. Healthcare is for everyone. We all have the right to that. Being in America, being in South Carolina, no one should be turned away. It's not a handout, it's a hand up.
When you look at the Bible from a Christian perspective, it is about the community, not a select group. The Bible speaks about God speaking to Moses to go back to Egypt to help a certain group that is not being served. And he has to speak to those who make decisions to say, you have to do better by serving this community. Jesus did the same thing. And so as we look at our nation, if we're declaring that it is a Christian nation, we should exhibit Christian values by looking at everyone who needs health care. So as a faith community and as legislators and decision makers, we should not run away from this issue, but we should take it head on.
So what happens next? How do we expand Medicaid in South Carolina to help our fellow citizens get the health care that they need? We need to educate ourselves on how Medicaid expansion will help South Carolina. We need to let people know that this is a very urgent need and something we can't kick the can down the road any longer.